Is your bladder being strangled and held down so you have to pee every 5 seconds because it can't fully fill and it can't expand properly? I hope not, but maybe. And what could cause that? So I'm Dr. Tammi Stewart from PT2Excel to talk to you a little bit about bladder health and what can happen. So this is a female pelvis. This is the bladder. This is the uterus where babies grow, fallopian tubes, ovaries, other fallopian tube, ovary. So notice that the uterus sits right on top of the bladder. So if you've got scar tissue, if you've got dysfunction in the uterus, or if it's just struggling to recover after births, or any other abdominal surgeries, trauma, C-sections, appendectomies, etc., gut issues, all of the gut sits right on top here and then sits on top of the uterus and holds the uterus down. The uterus then holds the bladder down. So if you get all this pressure here that's just not moving and expanding and flowing well, then you can totally see how that would hold the bladder down, so then the bladder can't expand. The bladder's not very big when it's not full. It's only about yay big. That's significantly smaller than like my fist, for instance. So significantly smaller. It's maybe like, I don't know, a third of my fist. And when this bladder is fully filled with fluid, it can hold up to about 500 milliliters in a female, about 750 in a male. What the heck does that look like? That is about the size of a standard 16.9 ounce water bottle. So if you can imagine all of this water in here, it expands quite a bit. And if it's inside this pelvis, I'll put it back in here now, and it doesn't have any room to expand up, then because this is all scarred down or just inflamed or just really like heavy and bogged down for a variety of reasons, of course you're gonna have to go more frequently because you can't fit 500 milliliters or 16.9 fluid ounces in there. So maybe you only get like half full or a third full. So you've got to empty a lot sooner, a lot more frequently, because you just don't have the capacity because there's just not enough room in there. So what do we do about that? Well, all of our organs are essentially a type of muscle tissue. And so just like we can massage our arms and our legs and our backs to get our muscles to function properly, we can do what's called a visceral mobilization, visceral massage, to get those things moving properly, break up scar tissue, kind of lift things out of there so that it's just not weighed down as much. So we are skilled at doing this, do it every day, and we can totally help if this is what you got going on. And if it is, we can tell you. If it's not, we can tell you. So feel free to like, share, subscribe if you or somebody you know is dealing with something like this, that you maybe feel like your bladder isn't doing its job because it just can't, because you just feel heavy and bogged down and maybe swollen and bloated and all of these like ickiness feelings in that lower abdominal region. We can totally help you. So like I said, like, share, subscribe, call, text, we got you. So hope you enjoyed the video. Feel free to comment below, questions, concerns. We'd love to hear from you. Thanks.